What is important to have quality control in cannabinoids-based medicine?
If you use a medicine, if it's cannabis or something else, you want to make sure that it helps you feel better and not feel worse. But also you want to make sure that if you found something that works, that it always works the same way. So for those two reasons, it's important to know where your cannabis comes from, what's in it. So with cannabis, that means that the flower itself, you need to test it in an official laboratory that knows what they're doing for cannabinoid content. You want to know your THC, you want to know your CBD, the other cannabinoids, you want to know your terpenes. There's a strong indication that they work together to give a more holistic effect, so you'd like to know about that. But you also want to make sure that there's nothing in it that shouldn't be there. Pesticides that you add during the cultivation perhaps, you don't want that to happen. But also things that are unintentionally there, like heavy metals from the soil or fungi and bacteria that can grow on the plant. And those things need to be tested by professionals, so you will need to work with the laboratory. So it's important to know what is in the product, what is not in the product, because if you can control that and you find a cannabis strain that works for you, you can be sure that it works today, tomorrow, and also next week. If you don't know what's in your cannabis, it's very well possible that you use a cannabis strain today that works great. Next week you're going to get it again. It has the same name, it's still a white widow, but the chemical content is different and it doesn't work. And then as a patient, of course, you keep searching for a medicine that makes you feel better and not worse. And every month is a lottery. And that applies not only to the cannabis flower, because if you make an oil, then you're adding extra chemicals, you're doing extra things. So even if your plant material is amazing and exactly what you want, if you make an extract and then make an oil, and you change the composition every time in a different way, or you leave residual solvents in the oil, of course you're turning a really beautiful product into a not so great medicine. So during the entire pipeline, from production of the plants, the drying, the packaging, the extraction, you need to have proper quality control.
Perfect. So what is the difference between the administration forms, as you said, and the absorption in the body?
So the two major ways are vaporizing and an extract, an oil or a tincture. If you vaporize or smoke something, then the cannabinoids are decarboxylated, THC acid becomes THC, CBD acid becomes CBD, and then they evaporate. And the same happens at the same time with the terpenes. So what you get in your vapor or in your smoke is all the good molecules, and they all go straight into your lungs and into your blood.
Sure.
So that means that you get a really quick peak of active compounds, and then they are distributed around your body. So it's very fast. It also lasts somewhat shorter than oral, and it's a very unaltered way of putting the compounds in your body. But if you put it in your mouth and you swallow it, it has a long trip down all your organs. As a doctor, you know all about that, and your body changes it. So it takes longer before it starts to work. It also takes longer before it stops working, so you have more of an effect, maybe even up to 8 hours. But the chemicals in your blood are different. They're changed by your liver and your intestines. So for some people that's good, because sometimes the altered molecules are actually the ones that are helping you. But for some other patients and other diseases, maybe that's not the case. And maybe this degradation in your body is actually not helping.
Yeah.
So that's why when you have a good cannabis strain that seems to work for you, you can experiment with inhalation versus oil.
So when you talk about time, like what do you want to say, like short and long? So if you vape?
Yeah, that's a good question. People like to hear minutes and hours.
Yeah, they want to know.
Roughly, if you make an estimate and an average, I would say that if you inhale, so smoking or vaporizing, it's quite similar. In the effect it has, you have the first effect in about 5 to 15 minutes. It goes right in your blood and right to your head, so you feel it quick. And the peak is usually about an hour, and it stops working after 2, 3, 4 hours. Which is very good if I have a very strong pain suddenly or a strong migraine. So I have pain now and I want to get rid of it now.
Now, yeah.
Yeah, I don't want to take a pill and wait for an hour. Nausea, those things.
Exactly.
And that's when inhalation can really work. If I, for example, want to sleep through the night because I have sleeping problems, I don't want to wake up every hour to switch on my vaporizer and then take some puffs and wait until I fall asleep again. So in that case, it may be better to consume it in mouth. So it takes about an hour, more or less, to be in your system. Then the peak effect will be around 2 hours, 1.5, 2 hours, but it could last up to 4 or 8 hours. So you have to experiment with that, and you do that the most safe by, they say it start low and go slow.
Yeah.
So take your time. I usually recommend up to 2 weeks to find your dose, and you, every day, you make a little step.
Yeah, perfect. Yeah, thank you, that's super. So where do you get good information about what works?
Yeah, that's a very good question, because we live in the time of the internet and Facebook, and everybody talks, and I think there's 2 different main sources of information. One of them, the way that scientists and physicians like to see it, is clinical trials.
Sure.
So it is being done, but not very efficiently, I think, and there's too many diseases where you have to do clinical trials for 200 years before we tried everything, and somebody has to pay for it. Who's going to pay for all those studies? Then the other side, there's patients and their experiences. But the problem with that is if one person says that it works for him, it sounds very compelling, because I've seen it with my own eyes, it works, so I'm going to tell everybody
that works.
That it works.
Yeah.
But I am not somebody else. I have a different disease and a different strain and a different administration form. So what you need to do is look at people with experiences in large numbers. So you do surveys. So if you talk to a large number of people, there's a lot of things you can learn. But for example, you don't know what cannabis they have used. So in the end of the day, clinical trials have very scientific answers, but don't always know if they're studying the right thing. And a lot of patients, they have a lot of opinions, but we don't always know why that's the case, what causes what. So I think you have to bring those together, and that is, I think, what's happening in the world right now, that people who study patients and people who study laboratories, they start to meet each other in a conference like this one here today, and they can inspire each other.
And it's very important, this collaboration through the science and the doctors.
I think it helps that as time goes by, so we've been doing this for 10, 15 years now more or less, is that scientists become a little bit less scientific and get out of their university building and start looking what's happening in the real world. And patients and their activists start to think a little bit more scientific.
True.
They're not each other's enemy.
Yeah, true. Okay, great. It was really nice to talk to you. Thank you very much. Yeah, thank you.